to another episode of the Mother's War on Violence. We are a non-for-profit organization exploring ways to stop the violence. We'd like to thank our sponsors, WCBU. I'm your host, Yolanda Wallace, the founder of Mother's War on Violence. There are strongholds that start in families, that start in our community. So let's dive right into our next guest. Today, let's talk about telehealth and work balance. Our guest in our studio today is Katie Jones. Welcome.
It's wonderful to be here. Thank you.
Okay, so Katie, you work in the area. Before we start there, can you tell me a little bit about yourself?
Sure. I am a native Peorian, born and raised in Peoria, went to Peoria High School, and have my master's degree in social work. I'm a licensed clinical social worker, licensed in Illinois and California.
Awesome.
And I currently work in I have a main job and then a couple side hustles.
Okay.
You know how we tend to do
Yes.
that sometimes. So my full-time job is as a blended care therapist with Lyra, which is a telehealth company based in Burlingame, California.
Oh, okay.
And I love that. I've been there for a little over a year. I also have a private practice and work for BetterHelp, and then just have my own little private practice, very small. And then I also work for Bradley University as an affiliate faculty in the social work department.
Awesome, great. So how about, you have any children? You married? Or?
I do. We are married, and we have 4 kids, 2 of whom are adopted, 2 are my biological children, and the last 2 are still at home, ages 15 and 13. So we're getting close, Yolanda. We got a few more years to go, but I have one student who is at Richwoods, a freshman, and then one who is at what's now called Reservoir Gifted Academy. So.
Okay, I was going to ask another question, but I want to ask you, Katie, how do you do all that?
Believe it or not, this is scaled back, Katie, a little bit because I have worked on trying to reduce my overall private practice work after having accepted the position with Bradley. This is only my second semester teaching at Bradley, so
great.
I usually only have about 5 to 10 private practice clients, so just a couple hours a week. But I have to practice what I like to say, outsource, delegate, say no, and ask for help. And
I'm learning that. Say no.
You know what? This book that I brought to talk to you about today, she is teaching me this. So for example, as a parent, you get when your kids are in school, you get a lot of requests for Sign Up Genius to bring snacks to this or that.
Yes.
And I found myself this past year signing up for things and then forgetting that I had signed up for them. That's not good.
Right.
The kiddos need their snacks.
Yes,
so
that's
a sign for me. That's kind of a warning sign that I'm overextended and I need to start saying no.
Right. And what's the name of this book?
This is called Set Boundaries, Find Peace, A Guide to Reclaiming Yourself by Nedra Glover Tawwab. And she is a licensed therapist.
Oh.
She is, I came across this book at a bookstore in St. Louis, just kind of very unintentionally last year.
Okay.
But she has been featured in the New York Times, in Psychology Today, in several other publications, and she's also got quite a few followers on Instagram. I love this book for lots of reasons, but one is she has an entire chapter on social media.
Wow.
So if you think about how much we need that, in terms of setting boundaries on social media, she really practices what she preaches. And then she also has a quiz in the back of the book where you can kind of ask yourself questions. How well do I do with setting boundaries? And I'll just say I did not get a 100% on that quiz.
I don't think I would either.
No, we all have issues that we sometimes have a hard time, saying no, or we have a hard time taking care of ourselves sometimes, things like that. So I love this book.
Yeah, you're right. It's got 16 questions. Boundaries is really important these days and times, especially with everything speeding up and going so fast, and we're working, and like you said, lots of people are working multiple jobs. So, that is a lot. I mean, but I commend you for all your work.
Oh, well, thank you.
And
you too. You too. I am so much in admiration of your work, your passion, the ways that you've channeled your pain into growth and helping others, and so inspired by Mothers War on Violence, because if you think about how mothers have often been come together in solidarity as a peacemaking entity, and that's what we have to do to heal one another, to take care of ourselves.
Amen. That's true.
So love the work that you're doing.
Yeah, well, thank you so much. So you got all these different careers going on, and these different things that you like to do, and balancing the kids, and I'm sure the kids are in sports and stuff like that.
Yeah, thankfully they're not in as much this semester, but boy, it was a real comedy of errors in the fall, because there was 2 different plays, and basketball and softball and student council and church stuff. So, never a dull moment. But that's, the opportunity to work at home and to be a telehealth therapist has really freed me up to be a little more present, to try to balance those, or spin those plates, if you will, with all those activities. During the pandemic, I was working in a clinic space and a hospital space, and it was really tough. As you know, I'm sure everybody had such a tough time, but I just found that.
So what do you do being with the telehealth? Is it for your social services?
So teletherapy. Okay. Thanks for asking for that. Okay. Teletherapy is telehealth counseling, so mental health counseling. Just as in the past, you would always go into someone's office and visit with them one-on-one for counseling. It's become, the telehealth field for mental health counseling has become much more robust over the last several years. It was already growing in popularity prior to the pandemic, but during the pandemic, mental health counseling and doctor's visits became almost exclusively, almost exclusively available online. So we became all of us suddenly, necessity is the mother of invention, as they say. So we all got very good and comfortable with that compromise. And I had already, talk about side hustles. Just to go back a little bit, I was in clinic working in different hospital settings, and my son had the opportunity to go to Europe on this really amazing trip. He was supposed to go in 2020, so I had about 10 months to raise about $7,000, which I just didn't have sitting around, Miss Yolanda. I just want you to know. So I said, okay, well, let me do a little side work, and I picked up a job with what's called the company is called Able To. And so I had started doing telehealth counseling. At that time, 100% of my clients were Medicare recipients.
Okay.
And that was a really fun job. I loved it. I didn't feel like work, because I would be laughing out loud, the stories and the ways in which I could engage with my clients. It was really fun. So
you found your calling.
I loved it. My average age of client was 75 years old.
Wow.
And everyone had, some health issues and often pain. And yet they didn't mind talking on the phone for counseling, because they grew up using the phone for communication, whereas kids these days, they just want to text, they don't want to talk on the phone as much. So I really liked it, and then in 2021, I decided to go full-time into working from home, doing telehealth counseling, and then last year, 2022, I started working for Lyra. And Lyra as a company really prioritizes diversity, equity, and inclusion and belonging practices, with a very heavy focus on making sure that marginalized people who have been part of marginalized populations with regards to the mental health system, not represented in positions of leadership and positions as providers, not felt like they had access, didn't feel like they were listened to. Those are our leaders at Lyra, and I just attended yesterday an anti-oppression provider certification training.
Wow.
Which is so important. You know, we talk
It
about
is.
wanting to fight against discrimination. We talk about wanting to
Stop the violence.
Of course.
But we have to look into all our systems that we have, the medical,
Yeah.
the education, the employment, and the way that they've been set up years ago. I mean, things have changed, but some of the laws and the way they work in those corporations haven't.
Absolutely, and that's been my experience. And even sometimes companies that say
Right.
that they're very focused on diversity and inclusion don't really know their way around that topic, especially if a company does not have a good, strong practice of hiring and being culturally humble to recognize the leaders, to recognize what they don't know. So, you know, I still have a lot to learn, but I'm learning that we're all in this together.
Well, I'm just excited that you're a leader who's interested in that kind of stuff. Most leaders and hierarchy professions are not really as interested in those things as you know, as you are and as they should be. And so sometimes it causes I don't know, it can be monotonous to them just to go to a training. I'm glad that you're interested in it. I'm sure Bradley certainly is,
Yes.
welcomes that.
Oh, well, I've been very blessed to get to join the Bradley faculty, but the students are the ones who really teach me every day. You know, this was Holocaust Remembrance Week this past week, so we talked about the ways that our country didn't do a very good job of addressing immigration during the war in a way that was non-discriminatory. That's putting it lightly. We
Right.
watched a U.S. and the Holocaust special on PBS. We also talked about how, you know, how can we as social workers and as people in our community embrace opportunities to work together and uncover the truths of our history that we didn't learn growing up.
Yeah, now that
You know,
the
like,
history.
I, you know, growing up, even in Peoria, I
know.
never learned about redlining until I'm sure graduate school. I mean, I never learned about that, but yet we live in this community,
And this is what goes on.
and then we look at the legacy.
Even in Peoria, you know,
100%.
I thought it's showing all these historical things like redlining and all that kind of stuff. They're showing up in movies, so we can't ignore them if we tried. So
No, and so I love the work that you're doing in terms of asking how can we come together. And just recently, you had another friend of mine who is a mother, Barbara Hedrick. She and I were colleagues together at OSF Strive, and you know, near the holidays, I said, you know, our family wants to do something special. I bet you know a family that would benefit. And I, you know, even though I don't work in trauma recovery currently, I felt a yearning to stay connected. So
Well, that's
she
good.
took care of me. I knew she would.
that
She
is
took care
so
of helping
awesome.
us.
That's just like Barbara.
I know it is. But so if you think about ways that mothers come together and support one another, and I think about telehealth counseling, going back to that, counseling is more available than ever. Big companies like Starbucks, for example, provide benefits through Lyra as an EAP for free, up to 20 sessions a year.
For their workers,
Baristas,
Wow.
everyone
Their
from
employees.
the
Wow.
frontline employees, or they call them, I think, partners, all the way through their hierarchy. And other companies are more and more making benefits eligible to all of their employees. And so what I want to encourage your listeners to do is to look into whether your company offers an EAP service. EAP sounds kind of mystical and confusing. I didn't know what it was for a long time, but it's like an employee assistance program. And it's often the case that an employee is offered free counseling up to a certain amount of sessions, like 5, 10, or more sessions, that they can go without billing insurance. They just meet with a counselor, just like regular counseling, and that person is there to help them try to figure out, well, what is it that you want to work on. We all often do short assessments to track the progress, so it's not just a subjective, how are you feeling, but like we really watch for symptoms of anxiety and depression and so on. So there are many EAP services in our community. Many companies offer that, as well as insurance that's covered through like Medicaid, Medicare, or private insurance.
Okay, because I work for OSF and home care hospice, and we're starting to learn about telehealth, and during the COVID times, it seemed like that kicked up even more.
Yeah.
With people living at home and not being able to get out and come in, and
Right.
not wanting, and I'm sure that's still the case now, because the COVID is, when the weather changes, it's back up high. When
Right.
it goes back to normal, it's down low, and so. And I know we have some telehealth things for the employees there. And then speaking of telehealth, I was just having an interesting conversation with our producer, and we were just talking about how, mothers are, after they have a child, it's so important that we follow up to see how the baby's doing, but how about how the mother's doing?
That's been a real area of interest for me, going back to when I had my own babies, my own pregnancies, and also in private practice, addressing the needs of parents right after their children are born, and looking for possible, postpartum depression, or even the impact of having a new baby on both partners. If you have, a husband, wife, or two partners raising a child, it can be very stressful on the relationship, on the finances.
Of course.
So, telehealth has exploded in access. And I want to say that one of the silver linings of the pandemic, how horrendous it was for everyone, but one of the silver linings was that it made insurance suddenly became willing to cover it.
A lot of good things came out of it as well.
And many of these platforms are available on a cell phone. So you can pull up your counseling session and set your phone right here. And your baby, I often will have my client with a toddler or a baby right there with them. And in the past, I think it was harder to tag along the kids or, try to fit it in your workday. But I'll have clients who will call in for their telehealth appointment during their lunch hour, or they'll reserve a room, a conference room at their workplace. Yeah. And so I think I want to offer that to your listeners too, that the access to mental health services is growing. It's expanding in terms of our idea of what counseling is. Right. If you'd asked me 5 years ago, is telehealth counseling as effective as face-to-face counseling, I might have been skeptical. I might have been like, whoa.
Right.
But had I not done that work through Able to and had such a positive experience, and then gotten, to work in a similar capacity with different companies and now Lyra, I loved when I was in person with my clients. I got to do a lot of tactile things. We would make collages in my office and things like that. But we do different things where I can share my screen really easily or send them a link to a little, Mayo Clinic website thing on side effects on medications very easily. Right. There are things that technology makes available that I think we're more and more aware of. Now, there are sometimes the glitches. Let me not be fail to say there are sometimes glitches with technology, but if the video conferencing doesn't work, I'll say, how about I just call you? And then we do a phone call, and then you keep the continuity with the clients. So,
that's interesting when we think about the COVID years and the impact it had on telehealth. And it encouraged me to use my Unity Point, use my OSF healthcare, use my, use my OSF My Chart, so that I can stay more in tune with the doctors and even multiple doctors. You go in there and you can see all that. You can send that doctor a message, receive one from the other, as well as, like you're saying, if you have some mental health issues, you're able to send a message to report, well, this is happening, that's happening, and what can I mean, do I need to come in, or can you prescribe something for
Yeah.
me? And then referrals as well. So
Yeah.
so telehealth is really good for referrals too.
Absolutely.
So
I wanted to say something else that came up this week. We were talking in my social work class about the different ways that we intervene in our community. As social workers are going to often intervene with the individual, but also within community organizations, advocating,
Right.
like with this podcast, but also through
you.
other ways that we come together. Moms Demand Action is a local organization working with crime survivors speak, and for others who are part of the movement to kind of give a voice to the need to fight against violence. So much happening in our community, and so I tried to talk to the students this week about how would you get involved at the community level, and then how do you get involved at the policy level? How do you stay abreast of what's happening at the local, state, and national level with regards to issues on preventing gun violence, preventing domestic violence, other types of ways that we can advocate. And so, it's really, I feel it's important that we're all part of that solution. If I'm not part of that solution in one or more ways, then I'm part of the problem, because I'm kind of a bystander. I need to be an upstander. I need to be standing in my community and try to be part of the solution.
That's right. I'm glad that when we're talking about stopping the violence and stuff like that, we have a park here in Peoria that reminds us of the violence that has taken place, and that's the John Buckley Memorial Garden. And it has some activities that it does throughout the summer. There's a fundraiser down there, Plant to Remember. There's different ways for people to get involved.
Yeah.
We are doing something with Moms Demand Action this year.
I'll have to tune into
gun
that.
violence. Oh yeah.
In
so
June?
it'll
Is
be,
that in June, do you know?
It will be in June.
Okay.
I don't have the correct date at this moment, but I'm excited about what it can do to actually. So we're all trying to stop the violence and stuff like that, and most things at the Memorial Garden are posts, but it's also a place of reminder, a reminding that there's. You look around that little heart, and it's got those bricks there for murder, suicide, drug overdose, and that auto-related deaths, so that people can get a brick if they want to there, or place a bench there in the memory of their loved one. Speaking of violence and tragedies, I often think about the two professors who were here at Bradley University that were tragically killed. And a lot of times I think that it'd be awesome if the Memorial Garden could partner with Bradley on having a bench or something in the memory of these professors.
Right.
Why is that important, you would probably ask? It is very important because whether we were related to them biologically or not, everybody around them was affected by that violence.
Completely.
Yeah.
And OSF Strive, as you know, as Barbara spoke about, it's not just the actual victim or survivor of the crime, it's the family, it's the witnesses, it's the extended family and community. Even when there is violence in our community, I remember when my youngest child, who's now 13, was going to public school for the first time. She'd gone to a private preschool, and on the second day of her school, we got an alert on our phones from the school district that there was an active shooter being pursued on the school grounds.
Right.
And thankfully, no one was hurt, and the police apprehended the suspect. But I remember thinking just how, every one of us has this fear of our children in schools. And even though that's not as common, our kids grow up from day one learning about how to hide in the closet, or how to, escape through a window, or My son, who was 17 at the time of the Parkland shootings, that tragedy, I felt like I really wanted him to have a voice and to feel like he had some sense of agency. And so he became active in working with Moms Demand Action, Students Demand Action, speaking with legislators, spoke at our church.
Right.
Because I didn't want him to feel like, this was just happening to him.
Or just feel like a victim that he had no. Yeah, and that's the thing that I try to heighten the awareness of, that very thing in Peoria, that those people who are victims, they need to be part of changing the atmosphere.
Yeah.
So if you just look at them and pity them and give them a pat on the back, but you don't partner with them, you don't ask them to be a part of. Sometimes I feel like that. It's like, you look at me like I'm a strange ornament on the wall. I don't want your pity.
No.
I want your partnership.
Right.
I want us to get together, roll up our sleeves, and do something about it.
And we have leaders in our community that are making that possible. I see that with the health department.
Met them yet.
I was so pleased.
Yes, the health department is one that I say is doing a really good job on that.
And I listen to the radio and I hear, about people coming together. And a friend of mine says, "Well, I'm on the board of House of Home." I'm like, "What? How'd you get on that board? How do you, And so we all need to be part of the solution.
That's
one
what
way
I'm
or another.
saying. Yeah, but I'm
blending
saying
together those solutions.
but especially those victims who've been involved with that 100%. Kind of stuff, because we have all kind of psychiatrists, social workers, therapists, and on the much higher level. But the thing that I like about what the health department is doing, they're getting the ones at the lower level.
People with lived experience.
Yeah, lived experience.
Yeah.
So we don't have very many agencies like that, is what I'm saying. And we don't have that partner with people like that. If you see poverty, most of everybody else is on the way top of the food chain, and everybody else is at the bottom. And so most people don't use them as an asset to
have a place at the table.
Exactly. I'm saying, what's wrong with saying we can have a place at the table, you can come and speak, and it's okay. We want to be a part of what you're doing, and so you can be a part of what we're doing, to close that gap, because all it's going to do is make us a better place. There is
something called you're making me think of something within the mental health system that a lot of people don't know about. I think that if you know someone who has experienced any kind of depression, anxiety, substance use disorder, grief, extended complicated grief, and they want to be part of the system of care, they want to have more than just a seat at the table. They want to have a voice. They want to advocate. Yeah. There's something called certified peer support specialists that the state of Illinois, through the Division of Mental Health, makes available. Okay. And people who have that lived experience can attend classes, meet other people who are in that peer environment, and become paid employees at the mental health center.
See, that's what I'm talking about. I think that I call it extending the olive branch to the victim to be more than just a voice. Most places where I go and speak for, I'm volunteering all the time.
Yeah, right.
So along with working a full-time job, you know what I'm saying? So
it's
what's
a side
wrong
hustle,
with that?
But it's not paid.
Yeah, right. It's I'm passionate about it because I want to do some solutions. But I know that in my own paradigm that I just can't do all these things myself. No. Talking about work balance without the Lord. For me, that's just how it is. But
if your listeners are interested in learning more about that program, they can put in their Google browser Illinois Division of Mental Health Recovery Services. And there's a very robust website in there. I can get you that information.
Okay, that'd be great.
So that other people can follow up, because we really need to be changing the system of care. There needs to be more kind of bottom up,
instead of all the big wigs at the tops trying to do it. Sometimes that's how I feel about the different grants that they have that are supposed to help this type of situation. Yeah. all that money that comes into the state or into, our counties and stuff, it goes to the administration level and it never reaches to the lower level where people are actually hurting, where it can really make a difference. Because see, if you found a way to get those people who are low in poverty, good jobs, who are passionate about their voice and being heard and stuff like that, and you put them to work with that, then and only then I think you can probably try to get some things changed and turned around, because then you're building trust.
100%. That's
So if
so
you don't
important.
have that going on, and when you're talking about all those violence, there is no trust in violence.
And also,
that's how we as a community bridge that gap, I think. So
no, I think you're right, and thank you so much for bringing a voice to these issues from your perspective. And also I just love the audacity
Thank
to
you.
honestly speak the truth about those challenging dynamics and the need for that. And that's actually, I think, the biggest area of growth in our mental health field, in addition to telehealth, is the voice of the people. And so that's where we need to be going in the attempt to really understand and cure violence in our community, is to listen to the voice of people who are closest to it.
And so, we that is a good point. That's I know you probably did not know this, and I don't think I've ever mentioned it on the show, but did you know cure violence used to be ceasefire?
Okay.
So
did? That's another incarnation. Is it an incarnation?
It's the
violence?
same program that just changed the name. Yeah. So back in 2006, you already know the story that I pushed for a ceasefire 2 weeks after the death of my son. So, and, we had the 40 days of fasting, work with Carl Cannon, work with the churches. Everybody was, City Hall, the work with Bruce with the prayer furnace. I mean, it was, so you had faith-based involved, you had everybody involved. That we were all volunteers and trying to get a change. First United Methodist Church, everybody was involved. The prayer vigil started, Pastor Harvey Barnett, and it just went and it grew. And then it went from ceasefire to the safety net program, which is the same program, from safety net to cure violence. 16 years of history.
Some of the same people working within
and with a lot of the same people are still engaged to this day.
Good.
I'm a stockholder, of course. I'm not going to miss that opportunity.
Right, no.
So, and if the opportunity presented itself, I will show up. That's why I try to tell some of, when we get to some of those meetings that we have, that, I know that we stress about education, which is very important still. But there's regular common folks who still want to be involved, who's been directly affected by violence, who need to be part of the healing process to change our community. Thank you so much, Katie, for joining me today.
Thank you.
And I'm going to get ready to close with my Bible verse that I love to read. And it comes from 2 Corinthians, the 10th chapter, and the fourth verse. In the King James Bible, it says, "For our weapons of our warfare are not carnal, but are mighty through God by the pulling down of strongholds." By bringing the topics out that affect our communities the most, exploring where violence starts and ways that we can try to stop it. Again, thank you for listening to Mother's War on Violence. We hope that you tune in to our next episode. You can follow us on Facebook, Mother's War Against Violence, where I will post the information that Ms. Jones has presented with us today about getting involved. Thank you.